Hello, I'm Dr. Carolyn Richardson, and this is Tips After the Visit, videos with health information that has been helpful to my patients and their parents. You might find this information useful also. Check with your child's pediatrician or medical care provider to make sure that this information is right for you and your child. Today, I will be talking about feeding issues with the newborn. Some parents brought in their 3-week-old newborn because they were having some difficulties with feedings. The mother was trying to breastfeed the baby and she felt that she was not producing enough milk. So then she started trying to give the baby infant formula and she felt that the various types of formula she was giving the child were upsetting the child's stomach. I checked the child very carefully to make sure that the child was growing well. I verified that the child was wetting enough diapers in the 24-hour period, that the child did not have a fever or any other sign of illness. After I determined that all was well with the child, I had the parents sit down to explain to them what is going on. First of all, newborns in the first couple of weeks of life require 16 to 17 hours of sleep a day. If they're being fed every 2 hours, their sleep is being interrupted, and then they're cranky, so now they're sleepy, and so then they don't eat well, so they're hungry, so they just get in a cycle where they don't eat well, they don't sleep well. Now the mother's upset, the baby's upset, the whole household is upset. So what you want to do is make sure that when your baby is asleep, you're sleeping, especially in the first couple of weeks of life. For breastfed babies, I advise the mothers that for the first couple of feedings in the morning, let the baby nurse every hour and a half so that the baby can get good practice and it will signal their brain that they need to produce milk. That way, the baby will get established and they will be able to nurse on each breast. The mother will then the baby will empty the mother's breast effectively, and then over the course of the next 3 hours, the mother's breast can refill, the baby gets some good rest, the mother's breast refill with milk, and is ready for the next feeding. For babies who are drinking formula, when they're in the newborn nursery, and they reported to the nurse that the child drank a half ounce, the nurse was like, "Oh, that's really great." But that's only good for the first couple of days. Each time newborn babies eat, they're able to hold more and more milk in their stomach as their stomach gradually increases in size. For babies who are on formula, with each successive feeding, they should eat a little bit more and a little bit more until they're drinking 4 ounces every 4 hours. Breastfed babies sometimes can eat a little sooner, but usually if they're nursing every 3 hours, 3 to 4 hours, that's good food intake. Now, a word of caution. If the baby has a fever of 100.4 or is not wetting at least 7 to 9 diapers in a 24-hour period, the baby is becoming less and less interested in eating. If the baby is crying excessively or barely cries at all, any of these could be a sign that something is very seriously wrong and the child needs urgent, if not emergency, medical attention. If you have determined that all is well with your baby and the checkups with your baby with the doctor have shown that your baby is demonstrating good weight gain, just be patient, wait for your breast milk production to come in, or make sure you're feeding your baby a little bit more formula each feeding, and all the feedings will go well. You will be rested, your baby will be happy, your baby will be rested, eating well, and all feeding issues will resolve. Well, that's all for now. Check each week for new tips after the visit. Thank you.